Persistent abdominal pain, a warning sign of colon cancer. I thought it was just a bad stomachache that wouldn't go away, whispered James, his eyes distant as he recalled the months leading up to his life-changing diagnosis. If only I had known what my body was trying to tell me. James's story is not unique. Every year in the United States, over 150,000 people are diagnosed with colorectal cancer, making it the third most common cancer in both men and women. But what's truly alarming is that rates are rising among younger adults, with 1 in 5 new cases now occurring in people under 55. Dr. Emily Chen, a leading gastroenterologist, explains, persistent abdominal pain is like your body's alarm bell. It's trying to tell you something's wrong, and we need to listen. For James, that alarm bell rang for months before he sought help. I kept thinking it would pass, that it was just stress or something I ate, he admits. But as weeks turned into months, the pain became his constant companion, joined by unexplained weight loss and fatigue that left him struggling to get through his workday. It wasn't until a particularly severe episode landed James in the ER that doctors began to suspect something more sinister than a typical stomach bug. Blood tests revealed anemia, often a sign of internal bleeding. A follow-up colonoscopy confirmed their fears. A large tumor in James's colon, already at stage 3. How did we miss this? James asked, shocked by the diagnosis. It's a question many patients grapple with, especially when they've been diligent about their health. The truth is, colon cancer can be sneaky. Early-stage tumors often don't cause noticeable symptoms. And when they do, those symptoms can mimic many less serious conditions. Let's break down some of the lookalikes that can mask colon cancer. 1. Irritable bowel syndrome, or IBS. Like colon cancer, IBS can cause abdominal pain and changes in bowel habits. But IBS doesn't typically cause bleeding or unexplained weight loss. 2. Inflammatory bowel disease, or IBD. Conditions like Crohn's disease or ulcerative colitis can cause similar symptoms to colon cancer, including abdominal pain and bloody stools. However, IBD is usually accompanied by other symptoms like fever and doesn't typically cause the same kind of unexplained weight loss seen in cancer. 3. Diverticulitis, this condition, where small pouches in the colon become inflamed, can cause severe abdominal pain. But the pain is usually more sudden and intense than the gradual onset often seen with colon cancer. 4. Hemorrhoids. While these can cause rectal bleeding, they don't typically lead to the persistent abdominal pain or other systemic symptoms associated with colon cancer. 5. Ovarian cancer. In women, this can sometimes be mistaken for colon cancer due to similar abdominal symptoms. However, ovarian cancer often causes more upper abdominal discomfort and bloating. For James, the journey from diagnosis to treatment was a whirlwind. Surgery to remove the tumor was followed by months of chemotherapy. It was tough, he admits, but knowing what I was fighting for, more time with my family, a chance to see my kids grow up, that kept me going. Today, 2 years after his diagnosis, James is cancer-free, but his experience has left him passionate about raising awareness. If I had known the warning signs, if I had gone to the doctor sooner, maybe things would have been different, he reflects. So, what can you do to protect yourself? Dr. Chen offers this advice. Don't ignore persistent abdominal pain, especially if it's accompanied by changes in bowel habits, unexplained weight loss, or fatigue. And don't wait for symptoms to start screening. For most people, colon cancer screening should begin at age 45. Earlier if you have a family history or other risk factors. Remember, early detection is key. When caught in its earliest stages, the 5-year survival rate for colon cancer is over 90%. But as the disease progresses, those odds drop dramatically. James's story is a powerful reminder that our bodies often tell us when something's wrong, we just need to listen. So if you're experiencing persistent abdominal pain or other concerning symptoms, don't wait. Talk to your doctor. It could be nothing serious, but if it is cancer, catching it early could save your life. As James puts it, don't be afraid to speak up about your health. Your life might depend on it.